Are you, yeah, we should be live. Are you able to share your screen, Michelle?
Let's see.
Make sure you're all prepped to go. Hey
Yes.
guys, welcome in. We are now live in the 5-Day EKG Facebook group, and we are just getting the finishing touches put on for us to go live with our featured events of the evening. And Michelle, I think your screen is like halfway or something. Do you?
What's going on?
Okay, maybe try sharing it again. But in the meantime, we're going to have our hostess with the mostest, Michelle Barkley, going to kick it off with a game for us tonight. Looks like we're going to be doing Family Feud.
Yeah, for tonight we're going to do Family Feud, and
okay. So I'm gonna give the floor over to you, Michelle, and we'll just get going. We'll kick it off.
It's super loud at the beginning. Hold on a second, and it will.
Okay.
I am trying to figure out how to get that music off. I got it off the rest of the slides, but the first one's still a little loud.
Okay, no worries. This is so exciting. Okay, let's do it.
Hey guys, we're going to do Family Feud first. This is just a cute little game that we like to play. We're going to do a different one tomorrow, but I just kind of wanted to get you in the mood of doing games for review practice. Okay. So what I do is I show you the question. This one has 8 answers and you can type it in the chat. Are you able to see the chat, Jen? Because my chat went away for some reason. I don't know when I did the screen.
Good. I can see the chat.
You can. Okay. All right. And I'm not seeing it on my phone yet either. Are we live in the thing? There it is.
Live. Okay. I'll tag you.
Yeah, now it's coming up. It took a little bit to come up. Okay. So type in the chat or type in the Facebook group and tell me when Jen started talking about the 10-step system, can you name any of the steps? Doesn't have to be in the right order. I have them in the right order as she likes to do them. But remember, when patient is really sick and having a STEMI, you just go straight to what you're supposed to be looking at. So, but okay, so I can see somebody said, nope, not yet. That's me chit-chatting. Okay, so tell me some of the answers that you saw when, or just come off a mute and yell them out if that's easier for you or if you're a good typer.
Yeah, they're doing great.
Okay,
rate, axis.
Awesome. Okay. All right. So I heard, did I hear axis?
Yep. And rate and intervals and rhythm. And we have, is there a P wave? I like that one.
Is there a P wave? Yes. Yes. Because that's going to go in with rate and rhythm. So that's perfect. You need to have those P waves to go along with that. So yes. And intervals for PR intervals. So yes.
Oh, Cornelia said straight to ST segment if big sick.
ST segments. Yes. Perfect. Perfect. We got that. And I've got a couple more in there.
We have voltage. We have T wave analysis. Oh, Roxana says chief complaint based approach. I got to put on my
awesome. Glasses. Okay. Chief based complaint. And I heard a hypertrophy that went along with that one. Oh yes. I love the glasses, Jen. And the very first one, remember, if they are big sick or little sick. And you said that when you went straight to that ST segment. So that's just kind of a review on that one. All right, so let's do the second question. And this one is, so we talked about all the intervals. So on those intervals, give me some numbers on those. If your patient has a PRI, what is the normal PRI? What is a PR interval? What is a normal PR interval? What is a normal QRS? What is a normal QTC? And what is normal axis? So tell me some of the questions on that.
Okay.
I can see the chat now.
Well, you can see it now, Michelle?
Yeah, good? Finally it popped up. Okay. So I can see my QRS. Yes. And I can see the PR interval is 120 to 200. Yes. Perfect. PRI, QRS. Yes. Less than 12. PR. Yes. Perfect. Axis. I see axis there. Yes. Axis. Anything from 0 to 90. And what was our last one? Already forgot what I just put up there. Oh, the QTC. Yes, QTC, John. Yes, you got it. QTC. Anything less than 450 for females and 460, the other way around. 450s for males and 460s for females, because females need a little bit longer to get ready. That's how I remember it. Jen tells us that. Okay, so let's go to the next question. This one should be pretty easy. Do you remember what leads we talked about when the T wave is okay and when it's normal to be inverted? When it's normal to be inverted. Oh, wow, y'all are just like super fast. That is like popping by. Yes, Tian, Ashley, Roxanne, the names are going by so fast. Jen, everybody's got it. So AVR and V1. So my eyes, I love AVR. Once you've been in this group for a while, AVR tells you so much. She has like so many secrets and she is constantly telling us what to do. AVR is fabulous. You need to make her your new best friend with 12 leads. So AVR and V1, I look at them first and I'm like, okay, are you telling me anything? Are the T waves inverted like they're supposed to be? Yes, both of them inverted. Perfect. Yay. And then I can go and start looking at my other leads. And when we start talking about contiguous leads and reciprocal leads, but that's for later on. That's for later on. But I wanted to give you a little hint on that. Perfect. Y'all are so good. Awesome. Okay. Let's do one more question, because this one you should have. Your patient's having palpitations. Your patient's having palpitations, and this is on our monitor. What are you thinking? What are you thinking? What are you thinking about that? Can y'all tell me? I've got some questions. I've got STEMI. I've got something else. Something else popped up on there. K, your potassium. So yes, you want to be looking at your potassium. You want to be thinking about SVT, and you want to be thinking about AFib. Is this one regular or irregular? Regular or irregular? So what you want to think about first is, when I look at that, am I looking at my R waves regular or irregular? And these are totally irregular. So this patient with that palpitations is AFib, and you'd want to look at her blood pressure. Is this going over 100 beats a minute? Are you looking for RVR? All the things. So I'm going to stop there, Jen. I just wanted to give a little heads up on that.
Well, you got me excited to share the rest of this, so thank you.
I didn't give away my favorite ones.
I know. Well, we have more of that tomorrow. So Michelle's going to kick us off. And then the last part of the week, it's so nice when we have Michelle, because she just really like brings the energy up, and it's just fantastic. So thank you, Michelle, as usual. Michelle teaches our basic 12 lead with practice in our 30-day group. So if you like Michelle, you'll get to see her again if you join us. Now so thank you, Michelle, and keep asking questions if you guys have them. Michelle will be in the chat with us. And if you still need a workbook, PS, let us know, because Tori's in the group with us as well, and she can get that for you. The workbook looks like this. We've been filling out pages of it as we go. In fact, the 10-step system is in here as well in the workbook. And there's a page for tonight as well. And we're going to be doing night 3 and night 4 today, because yesterday we did the special surprise lecture where we kind of switched things up and had Mike Sharma come on and talk about our injured athlete, who, by the way, I'm sure you all have been keeping your finger on the pulse, no pun intended, of the situation. But I think he wrote tonight, he's able to communicate. And I think he wrote something like, did we win the game? So like super heartwarming, gives me chills. I'm sure it does for you guys too. But what a great way to kick off tonight with some good news, finally, right? So anyway, all right, let's do the rest of and we're going to give away the scholarship tonight. The last scholarship, and this is going to be, yes, amen to that, Marissa, amen. It's such good news. So we're going to give away the last scholarship at the end. I'll tell you who the winner is. I've already selected this winner, and I'll tell you more about that. But somebody was just saying something in both Facebook and Zoom about WPW. And so, it's kind of cool that right here you can see there's WPW. So it's actually right here for you guys to look at. And yeah, the P waves. So you got to look for the delta wave when someone has palpitations. And this was just a chance for you to practice finding them. All right. And the scholarship we're giving away is this here, the Casey Case scholarship. That was my dad. And his scholarship is being given away to the person who's participated in this challenge so far that has been the most helpful to other students. So I'll be telling you who won that at the end. But in the meantime, congratulations to all the people who have already joined us in the 30-day. A lot of you have already decided to join us for our class that starts next week on Monday. I'm super excited to have you guys just put your kits in the mail today with all the stuff inside, and I'll show you later what comes in that. Okay, so tonight we're going to talk about sports physicals, and what a better time to talk about sports physicals than right now. And we do this challenge every like couple months. And it just so happened that everything lined up where sports physicals are on our mind. So let's talk about the two things tonight that can be found that are wicked that we don't want to miss. We'll be talking about those EKG findings, and we're going to do it using a case. Now, case one is Kevin. Now, again, nobody's real face. And Kevin is coming in for a complaint, actually, okay? But he's young, all right? And so I put a picture of a teenager here, and I just wanted you guys to practice and type in the chat for me, just looking at him. Doorway diagnosis. Is he big sick or little sick? Nikki's already busting out ideas. I love it. So is this guy big sick or little sick? Just looking at his skin signs, looking at his face. Of course, we'd need vital signs. Yeah, he's a little sick. Marissa, Jen, Nikki, Roy, and welcome in, Roy, by the way, to the 30-day. We're really happy to have you. Danielle, Cornelia, you guys are all spot on, and I agree with you. So far he's passing the test, but let's keep looking. Now, his mom brings him in. She says, yeah, I just want to be safe. He's had some palpitations. And he's got what do we call this? If you've been rocking with me for a while, you know what we call this. Of course, we don't ever document this, but this is a good sign. We should actually name this and create a sign that we can use in textbooks. The cell phone sign. Yep, that's a good one. His skin looks great for a teenager. I know he also has no acne, which is awesome. He's lucky. Teenage disinterest, which is a good sign. It means he's probably okay, right? So this is I call it a positive text sign, but positive cell phone sign is also good. So we got some vitals. He looks good with good vital signs. He's got no history. All that is very reassuring. So far we're not that worried, but we got to do our ROS, our review of systems, and it's the ROS that gives it away. Status social media syndrome. Oh, that's brilliant. So is there any red flags in his history? Now, do any of you have teenage boys that are female? Do any of you have teenage boys? Because teenage boys do not like to call their mom to come pick them up from school. Like they'd rather be caught, I don't know, something else, right? Family history, Latoya, you're on to something. Yes. Does he have a sense of impending doom? Yes, that's also on there. Good. And then also, he's probably an athlete, and he is. These are all great. Okay. So what about this though? The family history, you don't like this, right? So if you heard this, what is something you would think about? If you heard uncle died of something wrong with his heart at age 36. Okay, PE, substance abuse. Yes, those are all good thoughts. And Marissa says hokum. Very good thought. Okay. Hokum, cardiovascular disease. We kind of glanced through a few of these last night when we were running through with Mike, WPW, James. Yeah, these are all great. So there's another one though that nobody's mentioned yet that we need to keep high on our radar. Okay. And that is, Remy wants to show you. I'm going to show you the EKG and then we'll tell you. Long QT, that's a very good one too. Bria, good job, Hokum. But let's look at the EKG together and see what our thoughts are. So, okay. So sinus arrhythmia is very common in athletes, yes. However, it's not a bad thing, okay? Especially in a young person, it's actually pretty normal. Now, Brigada, Michelle said, yes, that's good. And Mara fans, good. These are all really good thoughts, you guys. I'm liking where you're going. Good critical thinking. And when you look at this EKG, I just want to point out, does anything stick out to your eye when you look at it? Does anything kind of, are you like, I don't know, something's not right. Okay, ASD is also something that could be going on. Okay, so Jen sees the ski slope. Latoya said it looks wide. Agreed. The T wave is big and it does look a little sharp, right? So, and his ST segments are sloped. Yes. Okay. The skier is giving it away, right? So this patient does have ski slopes and they are in V1 and V2. And yes, Penny, the QRS is wide, but this is actually very pathognomonic for Brugadas, which is actually Michelle's favorite thing. She loves to talk about how it's chilly in the V's. Michelle, do you want to tell, I can't do it as good as you. Do you want to tell them your famous saying for Brugadas? She may be chagging and she can't probably get to us.
Yeah, I couldn't figure out the mute sign today for some reason. Oh, yes, I always say, because I have trouble with the words and correlating the V's or correlating the brugadas, the word brugadas and how bad it is. So in my head, I use the brr, it's cold, and nothing happens good in the V's, especially V1 and V2. So if you're looking at V1 and V2 and it's cold and you could go skiing on those slopes, it's brr, and that helps me remember brugadas.
Love it. Thank you, Michelle. See, I just can never do it justice. Michelle also has hard voices that are really, really fun. Maybe they'll come out tomorrow. So Marissa says that's very helpful. John is also a fan. Cool. Yay. All right. But here's the thing, you guys. So nowhere on here does it say brugadas. Okay. And that's the take home of tonight, is that the machine will not call some of these high risk things like that you've mentioned. Hokum is one of them. We'll talk about what that is. And also brugadas. So it's up to us to pick this up. So the finding is ski slope ST elevation in V1 and V2 with no reciprocal changes, meaning no ST depression anywhere else. Okay, this is worrisome because patients drop dead from this. It causes lethal arrhythmias like VTAC and VFib, and this is something that we cannot afford to miss. Does anybody, and type in the chat, does anybody think this looks like a right bundle branch block? Oh, Ron, another good one. Drinking a lot of energy drinks. Absolutely has to be on the top of our mind. I agree. And Zulima, yeah, Zulima. So tell us, does this look like a right bundle branch block to you? If you know anything about bundles, and if you don't, that's okay. We're going to teach you. Dieting, oh, it's a good one. Okay, it does actually have some, yeah, okay. It does have sort of a bundle-ish appearance. And it's not yet wide enough to be a bundle because it's not yet 120, but it has a bundle type appearance. Now I'm going to teach, Ron, you're lucky because you're in the 30-day. I'm going to teach you bundle branch blocks a different way. That'll make it foolproof for you. And we don't use notching, which is great. So, because it's not always accurate, but this is wide and it is a weird formation like an RSR. So this is going to flag for you when they have brugadas. It'll say incomplete right bundle or complete right bundle. And then your job is going to be to go back in and see if it looks like brugadas by looking for the ski slope ST elevation in V1 and V2, which this patient does have. Okay, so there's your skier, and it's in V1 and V2. Those are the money leads because lots of high risk things happen there. This is another example of brugada. You can see that it's got ski slopes again, and it's wide. And our EKG Mandalorian says it looks like sailboats to him, right? So these can look like sails. Whatever they look like to you, just burn this into your brain so that you don't miss it. Is it a zebra? Absolutely. Is it very common? No. But if you miss this and somebody goes and dies, I think we all have a new appreciation for that now with the fresh events of this week. Okay, so we have to catch this. It's not a STEMI. The machine may read it as a STEMI, but it's not. Now, let's talk about right bundle versus brugada. This is a very good nugget that nobody really talks about. So you may not have heard this before. And if you haven't, it's not that this class is too advanced or anything like that. It's just that nobody's teaching it. So, or maybe somebody is, but I haven't found them. So let me show you the difference. We just talked about, well, hey, what about this right bundle thing? How am I going to tell the difference between that and a brugada? Well, it's the width of the sailboat, or the sailboat, I guess, or the ski slope. Okay, this is very skinny, this is very wide. And that literally is the difference. And I always think too, which one would I rather ski down? I would rather ski down this one than this one because it's not going to be real fun. Okay, and that's one way you can look at it, right bundle versus brugada. Okay, brugadas, the treatment, they need a defibrillator to not go into cardiac arrest. So if we find this, we need to send them and get them referred. Okay. Yeah, Marissa likes the wider slope. I do too. We would get them referred to cardiology, and we would absolutely get somebody else involved in this case to make sure that we're not falsely calling it. So get somebody higher than us. So if we're EMS, right, Ariel, yeah, it's a very good way. Ariel, we would get someone else involved. And if we're EMS, like we'd have a doc look at it at the emergency department. If we're PANP, solo practice, make friends with the cardiologist, right? Because these are things that we can't afford to miss. And if you're an RN, or you're maybe an EKG tech and you pick this up, then absolutely need to have somebody look at it. So it presents in V1 and V2 Ron, take the name off the EKG and post it in our 30-day EKG group, and we'll look at it for you and tell you what we think. So here's how to never miss this again, okay? If you have somebody with right bundle plus ST elevation, okay, go look really hard at V1 through V3, especially V1 and V2, and ask the question each and every time about a family history of sudden death, especially young. And I'm going to tell you guys, this is a question I ask almost all my patients, actually. If they're coming in new, I've never seen them before, whether they're at ER, whether they're at cardiology, wherever I see them, I'm asking this question because it's true for like people who, oh, my dog's here. Hey, Ram. But anyway, it's true for people that have cardiac disease too, because if they have family history of young cardiac disease, you're going to worry more. So if you see elevation, look hard in V1 and V2 and ask somebody if you think it's Brugada's, okay? Because you definitely don't want to falsely call this or miss it. Okay. Yes. Okay. So Hokum, oh, thank you for doing the writing that out. Thank you. Thank you. Thank you. Hey, Crystal, what's going on? So we're going to talk about our next case now, and then we'll be finishing up the night after this, and we'll give away our scholarship. We'll be getting done hopefully a little early, trying to make these short for you guys, short and punchy, especially your cat is there too. So for some reason, cats like to watch the EKG classes we do. I don't know why. People put pictures of their cats all the time. My cat doesn't. I don't know why. Okay, so what's the most important thing to ask a sports physical patient? That's the family history, like Melissa Mainville just said. So we're asking anybody, right? This question, hey, anybody in your family ever die of young, sudden cardiac arrest? Or did they die young and nobody knows why? Or did they die young and they didn't have, like they weren't hit by a bus? It wasn't traumatic. And especially if nobody knows why, right? Because that could be Brugada's, because that won't be diagnosed on autopsy. Okay. What can be done since once diagnosed? With Brugada, you put a defibrillator in, and that's pretty much all you can do. And then you prevent triggers. So you prevent things that would bring out the Brugada pattern, like fever. You tell them when they're shaving to be really careful. And you tell them not to get a super, super full stomach, anything that would trigger an episode. So let's talk about this next case and this EKG. No problem. So I just want to play, can you sign the form? I just want to stop here for a second. How many of you guys work urgent care or family practice where you have to do sports physicals? I just want to kind of take a quick survey. Okay, Zalima. Okay, anybody else work urgent care? Because I know urgent cares are getting overrun right now. The ERs too, honestly. So we only have one urgent care provider. Okay, Janet, or somebody who does sports physicals. Because here's the thing, sports physicals do not call for routine EKGs. And that is in our guidelines. In Italy, it's different, right? Maybe we should all go live in Italy. Oh, that would be okay. We could have lots of pasta. So yes, sports physicals. So here's the thing. Pam, you do too? Okay, good. So what you want to do is you want to have some hot button questions and some ROS flags that would make you get an EKG, okay? And Roya also, yes, on Facebook, and Tammy, okay? So you guys should pay very close attention to this. If your patient has a murmur and they're young, okay, then they're young, it's not normal. It could be, let's just go back. It could be normal, but we're going to think worse first. Okay. And so what we want to do is we want to listen to the murmur. And I'm going to give you a thing you can do to test them to see if it's really something bad. But in the meantime, these sports physical patients and sometimes their parents will pressure you because they just want to play. And it's not that they mean any harm. They don't understand the risk. Maybe it's going to be a whole nother conversation now. I'm kind of hoping it is. But sports physicals are what drove me out of family practice. One of the things, because I just felt like these were so high risk. But looking back now as a seasoned PA, I'm like, okay, now I know how I'd approach it. So I would do the ROS, any priority symptoms, chest pain, shortness of breath, palpitations, dyspnea on exertion, syncope while exercising, strong family history of coronary artery disease, or somebody who died young. Those would all be flags to get an EKG. Now, let's just say that your patient, well, let's just say it's me, and you asked me to go run a mile. Like maybe I was chasing a taco or something because I love tacos. Otherwise, I'm not going to run. So let's say I was running. I would be dyspneic on exertion. Does that mean anything's wrong with me? No. But these people, these youngsters that are coming in to see us are usually fairly fit, right? So that would be a trigger to get an EKG, a dyspnea on exertion. So basically you have a low threshold to get an EKG. Now, this is the EKG we get on this young guy, and he has a murmur, okay? So this EKG is very bad. And the machine will read this as potential old lateral infarct, okay? Yes, some maybe for a taco. I definitely would. Ground beef for sure. So getting hungry just thinking about it. So let me point out what the machine is calling the inferior infarct. Okay, so if it sees Q waves, which we talked about on night 1, which was Monday, and it seems like already a long time ago, Q waves are the first negative deflection after the P. There is some Q waves here. They are skinny. They are not wide, and the machine may read this as old MI. But this patient did not have an old MI. They are young. This patient was actually read as possible old MI, but they wrote it off because he was young. And they were like, oh, you feel better? You had some, syncope after you were running. It's hot outside. You probably just are overtraining, and they let him go. And the next day he went out and mowed the lawn and went into cardiac arrest, because patients with, as Jen said, HOCM, which this patient has, are not supposed to exercise. They can go into cardiac arrest from exercise. So this patient has HOCM, and the Q waves were the ticket here. There's also a little increased voltage, which is the part that looks at the septum, which makes sense because usually it's a septal issue, or sometimes a widespread left ventricle issue. But at the core of it, there's too much tissue, and I'm going to show you a picture what it looks like. There's too much tissue getting in the way, and it causes the patient to go into cardiac arrest, goes into VFib or VF. Michelle actually does this great drawing where she puts zebras on the Q waves to remember that, yes, this is a bad thing. So Q waves, especially in a pattern like that, are concerning for HOCM. So what is this HOCM thing we've been talking about all night? Well, this is a normal ventricle. This is a thickened ventricle. This is what hypertrophic obstructive cardiomyopathy looks like. And the thickened tissue causes an outflow tract obstruction, which doesn't allow the blood to perfuse, and they go into VF or VF or VTAC. So when do we usually diagnose this is the big question. Are we diagnosing it when they're little, or are we diagnosing it in their 50s? What do you guys think? Yes, absolutely. Yes. Nikki would, and Cornelia after death. Yes, this is true. Marissa, for sure. Okay. These are all good. And it's true. It's autopsy. So hopefully that won't be the case now that it's on our radar. We can pick this up a little bit sooner. So Kevin, our patient from earlier, he was diagnosed with Brugada. He got an ICD placed, and his prognosis was fair. Who is diagnosed with this? Do you mean what type of patients? What do you mean, Melissa? Tell me more. All right. So that in a nutshell, let's go back. This patient also had HOCM, the one that we just showed you, HOCM, and that's what's causing the Q waves here. So if you see Q waves in this pattern, be very suspicious. And the maneuver that you're going to have them do is you're going to have them squat. Okay. So the murmur of HOCM gets softer with squatting, Okay. So you can do that maneuver in the office or wherever you're seeing them. Even if you're in the ED or urgent care, you can have them squat. And if it gets softer with squatting and EKG like this, that's someone that you don't clear, no matter how much they pressure you, because they want to play. So what types of patients? These are young patients, and it's hereditary. So they've had it all their lives, and we want to get to them early, of course, right? We want to get them as early as possible so they too can get an ICD, just like him. So basically the two big bad wolves we talked about are HOCM and Brugada. They both need defibrillators, okay? And they both need to not play sports, basically, is the moral of the story. So any other questions before we talk about the giveaway? Because we're going to do the scholarship. Any other questions? And go ahead and type in your questions if you have any while we, yeah, no questions? Okay, that means we covered things pretty thoroughly. Thank you, Crystal, for tagging some friends. I appreciate that. But let's talk about the scholarship winner tonight. So the scholarship winner, it's a female this time, and she's been, thank you, Michelle, I appreciate it. she's been in the chats, helping other people find the Zooms. She's been tagging people. She's been answering questions. And it's exactly what I was looking for this week, because as we know now, right, we're on night 4. This is a group of helping our fellow colleagues. And this particular scholarship winner did that. I have chills just thinking about how much she was helping people. She was non-judgmental. And I don't even know what profession she is, so hopefully she'll tell us. But our scholarship winner of our 30-day EKG challenge, to get full access for 6 months, is none other than Marissa Honey. So Marissa, congratulations. Let's all give Marissa a congratulations. I'm so excited because Marissa, you've been amazing. That's why when you mentioned in the chat right before, I was like, it's very important you come on tonight, Marissa. So thank you for everything you've done for your fellow colleagues in this group. We really appreciate it, Marissa. So I'll be getting you the information. I'll be sending you out your kit, your welcome kit, and you'll be one of our family. And hopefully you'll continue to bring that spirit to our 30-day EKG group and continue to shine your light on everybody, because we appreciate it. So one question I did see, Hokum has preserved ejection fraction. Aaron, yes, it does. Okay, well deserved. Yes, you are so welcome. So we're really happy. I'm going to tell you, Marissa, what you're going to get access to. And if anybody wants to join us now that we've done the scholarship, if any of you are waiting to purchase after you saw who was the winner, now's your chance. Tori will drop the link in both groups for us. But as a scholarship winner, or anybody who joins us, there's more classes than this. We just added some today. But you're going to basically come in, and on the 9th, which is Monday, we're going to meet up for our welcome call, where I'm going to show you around the group, and I'm going to show you all the EKG terminology. Okay, we're going to start the baby steps. Okay, the next thing we're going to do is we're going to have Coach Michelle, who, as you know, is just a love bug. I love you, Michelle. I'll be honest, I love you. You're like a sister from another mister. But she does a 12 lead class that's basic. And she looks at where the leads look, and she talks about, contiguous, reciprocal changes, all the stuff. And then I'm going to go back and do basic arrhythmias for us. And we're going to do a basic session on this, but then we also have practice with our paramedic, Sean Holt, who is our rhythms expert. He's going to come in and do a great talk so you guys can practice what you learn. And then Michelle's going to practice with you what you learned here. So we're going to put it into an implementation session, because we like to teach you something and then practice. And then speaking of practice, we're going to take all these classes on the 21st and do a 3-hour hands-on workshop where we'll use everything that I send you in the box. Then we're going to do something called study hall, where I'm going to basically just do topics that you're interested in. We'll talk about differential diagnosis, how to document to keep yourself safe, how to do medical decision making, things like that that are really pertinent. And then we'll do some chest pain cases. And we also have a lipid in February. I didn't put February up here, but we have like a lipid talk in February. We have a CHF cases talk. We have all sorts of other bonus stuff coming in February, but it's a really, really, really fun place to be. Now, actually, I think I put it here. So this is the other schedule I wanted to show you with the added David study hall, our wonderful EKG coach, David. He's our medic, who's our Mandalorian. He's going to do basic EKG for us. And then we have Gary. This is another thing I couldn't fit on. We have so much, can you tell? So we have Gary coming back on. If you got to see him earlier in the week, he's going to do that 12 lead version. What a lot of you were asking, I want to see the 12 leads. He only did rhythms this time, but he's going to do the 12 leads for us in this 30-day group. David's doing another study hall. And then February, we added a couple more things. We have Sean doing rhythms. We have more David study hall. And basically what we do with David study hall is we just, like, anybody who has EKGs, they want broken down, or he posted one yesterday. He was like, hey guys, here's a cool case. And everybody got to guess. And then he broke down with pictures the answer today. It was phenomenal. We also have pulmonary hypertension, a bonus lecture with our sleep NP Carissa. And that's just January and February. Like, we go all year round on this, and all times are Pacific Standard. Now, student rate, you can get all of this with no CE for just $127. You still get the kit. You still get 6 months access to all of our live classes. And as a bonus, we're throwing in for you also access to our last 2 years of all of our basic EKG that we did in a different group. So all the recordings. If you want to spend 3 hours on the waves, we can do that. If you want to spend a bunch of time on coronary anatomy, we can do that. Okay. That's all in the Launchpad, already recorded. You'll get instant access as soon as you sign up. We'll get you the link. for the those two groups. Now, EMS folks, you can get 12 hours of CE for only $149. You can get in for an RN as $199 for 6 months, and NP or PA for $249. Now, if you're thinking like, oh my gosh, I'm so busy, I can't make it to all these things, I'm just going to wait. You can totally wait. We will do something similar again later in the year, but the price is going to go up. So this is your chance to jump in at this rate and lock it in, and you'll get 6 months with us. And you literally do not have to come to anything live. Everything that's based on the CE is already recorded and it's in your learning portal. So it's not even on Facebook, okay? But the live classes are all held in Zoom and Facebook. So I think we have, oh yeah, okay, so good. Let's see, we have some questions. So I'm gonna go ahead and, yeah, Marissa, you're gonna love it. And yes, Michelle already answered the question. Everything's recorded except for Gary. And it's just because he won't allow us to record because of copyright issues. Her EKG would show sinus attack, totally. Where do you sign up? I think Cornelia, we just, Tori posted the link and she can post it again. And Jen, yes, see, Jen's in our group. She's amazing too. We have so many amazing people. And yeah, so, and then when you're in, if there's a topic that you want, me and Michelle can tag you and basically show you what's in the group. Once you get in there, there's a pinned post that tells you all the topics so you can find those. But in a nutshell, this is a really great place to be. I'd love to have you guys join us. If it feels like a right fit for you, if you need mentorship plus recorded classes, this is a good fit. Nobody's really doing this right now in the EKG space. So we created it because we were like, this is what we would want if we were learning. Michelle, I'm just laughing right now because I see, so I got to tell you guys this really cute story. So Michelle teaches in this room here, but it keeps growing with fun little things. Like she's got one of my paintings behind her. And she inherited a skeleton. So she has the V leads on the skeleton. She calls him Skelly. And some people were saying in our group, they were like, Skelly seems a little naked. So she sewed Skelly some clothes. You could totally
Got some pants on now.
Yeah.
So he's happy because he has pants on now.
Okay, yeah, Latoya, how long is the access? So here's the thing. You get access for life to your learning portal. Okay, that's the 12 hours of CE. You get access to those classes. You get 6 months access to the Facebook groups, but we give you an offer at the end to stay in with us longer. But that's just what you get with the very low rate that we've done. And we really, like, I would say probably 70% of people stay in the group with us and they could just continue on. Like we have had people, I think, that have been in for over 2 years now because we keep bringing in guests and keep the topics fresh. And yeah, we have CEUs. NPs can do it through the AAPA CE that we do. We've been doing that for years. And let me show you what you actually get. So you get this box, we send it to you, it's the EKG kit. And we send you in this kit, one of the best things is one of Gary's tools, because we'll use these in our workshop where we'll practice using the red line and we'll have, practice looking at this like he showed us the other night. We also send you 4 crayons because we use these to color code the sample EKG, which we include in here for you to draw on. So in my class on the 21st, we draw together, and I know in Michelle, she does it too, but we're very hands-on, very visual. You get a cheat sheet, which I'm not going to show you because it has all my trade secrets on it. You only get it if you join the 30-day. You get a small painting that is literally a custom painting. That's the only one like it, although they are similar colored this time. I made them all kind of match each other because I wanted you guys to be matchy. So you'd feel like you were connected. Every cohort that joins us, we like to make you feel connected. And then there's 17 EKGs you get in your box that are real EKGs that we go over together. And I show you on the screen how to solve them. And we do it in our live workshop on the 21st. So that's really, really super fun. So I'll stay on as long as you have some questions, but we're going to be back tomorrow night for our last session, and RNs, everybody gets access for 6 months, everyone. And then we extend you if you want to stay in for a very, very low fee. It's $125 to stay in for a year after that. So it's really, really cost effective, if you will. So basically, what else was I going to tell people? Yeah, everything is just like this. So we've trained you in this 5-day group to be able to be successful in the 30-day. We've trained you how to find the Zooms. We trained you can come on Zoom or Facebook, and it's just a really great environment. So we don't have anybody. We had one person in the 30-day that was kind of negative. I kicked them out. I was like, here's your money, go away. We don't want you in our group, because we preserve our students, we preserve the culture that we have in the group, just like this. And yeah, so it looks like someone is messaging for me after Zoom. Not a problem. Just hit me up on Facebook Messenger if you're too shy to ask here. I'll be around answering questions tonight, but we're going to be back tomorrow for one last session. And the session that we're going to do is probably the most important, because we're going to talk about non-specific ST2 wave changes, okay? And that is critical. We're going to talk about a case of a 36-year-old female who had a cough, but something really, really bad happened. And it was found in an urgent care. So that's for you urgent care folks like Zulima, right? Nikki says she loves us. We love you too, Nikki. Yeah, so I think, and if you have questions too, you can ask Michelle. Basically, we're both here, and Tori can usually answer questions. And here's the fun thing about Tori. She is our workshop concierge for our challenges. She's not medical, but she's been coming to our workshops like 4 times now, and she knows the patterns. So I'm telling you, like, if Tori can learn and she doesn't have any medical background, anybody can learn this. I mean, really, I mean, Tori's smart. Well, that's just a given. I mean, she's smart, but like, you can do it too. Go Tori, right? So anyway, that's all we have for you guys tonight. Hopefully we'll see you. I have to go put a couple more kits together and put them in the mail. But again, feel free to private message me on FB. And our winner, yay, Marissa, I'm going to make sure you message me privately on Facebook so I can get you all the links too. And Michelle, do you have any final thoughts or anything you want to add for tonight? Tori.
I had to get to my unmute thing. Yeah, I can't think of anything. I think you've covered it all.
Okay. Yeah. So
I'm a blank.
no, it's okay. So just hit us up later, guys, if you have questions. We're happy to answer them. And Michelle's going to kick us off tomorrow with our game, just like she did tonight, finishing up. And then I'll come on and do our case, and then we'll wrap up our challenge. There is a potential. You can type in the chat on Facebook or Zoom. There is a potential I might do a bonus session this weekend. If you guys would be interested, I might do a bonus session. So let me know if you'd be interested in a bonus. Type in the chat, and we'll definitely see you tomorrow. So thank you guys so much, and we will see you. Yes, okay. It sounds like there's some yeses. All right, I'll see if I can put something together for us. And type if Saturday or Sunday would be better, because I still haven't narrowed that down yet. So type Saturday or Sunday. Okay, we have lots of votes for Saturday. Okay, lots of Saturdays, a couple Sundays. Okay, all right, guys. We'll see you tomorrow night. This is awesome. Thank you again, Michelle, and we'll see you guys tomorrow.